This fall, NAN is heading to West Palm Beach, Florida. This year's conference will emphasize beauty in medicine, the innovations that make high-quality care possible, and the professionals who bring mastery to their units, all with a fun twist of artistic attendee events. Head to nan.org/conference to register now and take advantage of early bird pricing. We hope to see you there. Hello, and welcome to NANcast. I'm Jill, your host. Discharge from the NICU is one of the most anticipated milestones, but it's also one of the most vulnerable transitions for families. Discharge day can bring every emotion: excitement, anxiety, relief, and sometimes even fear. For families, it's the moment they've dreamed of. But for nurses, it's a crucial time to ensure parents feel ready and supported to care for their baby at home. And while we celebrate that day, we also know that for many families, it can come with a lot of uncertainty. I think we've all had those moments at the bedside when a family is getting ready to go home and you can see both the excitement and hesitation. And honestly, discharge can feel stressful for us as nurses too. We want to make sure we've covered everything, and we want to make sure families feel truly ready. So how do we make sure families aren't just discharged, but truly prepared and confident when they walk out of our unit? Today, we're talking about health literacy, discharge education, and the power nurses have to turn everyday challenges into lasting change. Joining me today is Dr. Samantha Sobie, a neonatal nurse practitioner and clinical specialist at AngelEye Health. She has more than a decade of NICU experience, and her doctoral work focused on improving the NICU discharge process and addressing health literacy, work that continues to shape how she supports families and care teams today. Discharge isn't just a moment, it's a process. Let's get right into it. Samantha, thank you so much for joining me today. Your doctoral work centered on improving the NICU discharge process. And I think every NICU nurse listening can relate to the moment when you realize, I don't really think that family's prepared to take their baby home. Before we dive deeper into health literacy and advocacy, I just want to start with the story behind your project. What was happening with discharge education on your unit that made you first think, something needs to change?
Yeah, I feel like my path to my doctoral project is a little interesting. So when I first started my DNP program, I had a really wonderful counselor, Dr. Leanne Nantai-Smith. She is just a powerhouse of an NNP and everything education. And she had asked me, okay, what would you like to do for your DNP project? I was kind of dumbfounded. I was like, I don't know. I have no idea even where to start. And she said, it doesn't need to be anything big. It can be something super small. And she was like, is there anything that you want to change? And I thought specifically about the discharge process and the discharge packet that we had on our unit. And I was wondering, I would love to fix this, but I need something concrete to actually make this change and kind of like bring it to the leadership and say, hey, we do need to make this change. So I tried to figure out a way for me to do that. And that's when the doors of health literacy opened up. So my DNP project kind of came from a really small issue that I had, or like a pet peeve that I had, and it grew into this massive thing that it is now, and my passion towards health literacy.
And I think that story really highlights how it's nursing that sees those gaps in, our care before anyone else does. So like your mentor said, like, what is it that you want to change? And you saw, we are really lacking at discharging our patients. And I think that's so stressful for nurses. It's stressful. It's not a streamlined process. There's so many moving parts. We always are told, discharge starts on admission, and we should be working towards that with our families. But like I said, there's so many times that we're at that point where discharge is right around the corner, and we're thinking these families aren't ready. And I think your story and your project is a true testament to how one nurse saw that there was this gap and how they can make, a profound impact on change in their unit. It's really inspiring. And it's a kind of an area that we all struggle with, discharging.
Yeah, 100%. And I love that aspect of one nurse can kind of start a change or ignite a movement. And I feel like it's really kind of the basis of evidence-based practice and how nursing has evolved as a profession. It's a lot of the changes that we've seen in our care is because one person says, there's got to be a better way. Let me try to find a better way to do that. And a lot of our growth as the nursing profession has come from one person wanting to improve something or seeing the opportunity to make a change for the better, not only for the patients, but also for the staff as well.
So you bring up advocacy. That's what we're talking about. And so can we talk about how advocacy fits into this work with discharge planning? And, we see how you sparked so much change. Can you share how that mindset that, it's just one person that can cause change, how that shaped your project, and then how nurses can use their unique role in helping families with discharge?
Yeah, that's a wonderful, wonderful question. So I do feel like nursing is a very special and unique profession. We are with these families, with these patients every single day for the entirety of our 12, maybe sometimes 16-hour shift. And I feel like there is, especially in the NICU, there's a special bond that forms between nurses and parents and that baby. And when it comes to educating them and helping them advocate and being an advocacy for that family, it's something very special and something that nurses really embody. So I feel like in the NICU, there's kind of this, I want to say, culture of love of our patients where we just love our babies so much and we love our families and we want to do everything we can for them to succeed. And the fact that nurses can really kind of hone in on how that family learns best. When you're a primary nurse for a baby, every time you come to work, you're working with that same baby and that same family. So, okay, this mom likes to do things hands-on. So I'm going to show her, let's say, gavage tube insertion if that baby's going home with a gavage tube, something like that. I'm going to show her that hands-on. But the dad learns better from handouts. So I need to make sure I get some handouts for him specifically. So I feel like there's this really unique role when it comes to educating and communicating with our families that nurses truly embody. And it's something that you only get from being at the bedside and spending all of those hours and all of that time with those families. And one thing I feel like I always strived for in my career, and something that I, also try to strive for now, is that we really have a duty as not only nurses, but also as healthcare professionals to really educate these families, empower them with knowledge so that they can advocate for their babies in the way that they would like. So, a lot of these families, they don't know what they don't know. We come in during rounds, we give them a big update, give them some new education on their baby, and then they stare at us and they go, "Oh my gosh, I'm so overwhelmed. I'm trying to process this. I have no idea what question to ask you." And they just look overwhelmed and like a deer in headlights. And this is really where I feel like nursing shines. We kind of sit down with them and we say, "Okay, what didn't make sense to you?" And how these families learn, how they interpret things. So you're able to kind of proactively act on that education and really help them advocate for their baby, because the NICU is a really scary space. And we want to make sure we're really helping those families be the best parents that they can be.
I love that. And it's so empowering I think nurses don't realize how much influence that they have on the families. And, we are that bridge between the families and the healthcare system, the bridge between the families and the medical team. How often are we trying to get the parents to be empowered to ask the medical team on rounds questions that they don't understand? And, we are encouraging them all the time. And we do have a lot of power and influence for these families, and we need to really take advantage of that and utilize that to be advocates for the families. And also, like you said, how powerful is it that we can make parents turn into advocates for their own child? So that's something that I think we really need to reflect on and realize that we are truly very influential to these parents. Even when we're doing something so little as helping them with their bath, how much we can help those parents build confidence, that they can go home and take care of their babies after discharge.
And I love that you use the term confidence too, because I did not use that word, but that is the perfect word for it, where, I don't know any parent that with their first child, they were like, I'm 100% confident taking this baby home. I'm not scared at all. I feel like every parent is like, oh my gosh, this is a whole new world that I'm entering into. So anything that we can do to help build that confidence and show them that, hey, yeah, you do got this as a parent is truly something wonderful, and something that I feel like nurses do every single day.
New to NAN? Join as a group and save on membership while building connections with fellow neonatal nurses. Groups of 3 to 9 new members save $10 each, and groups of 10 or more new members save $20 each, making it easier than ever to join your professional home together. Learn more at nan.org/group. So a lot of your work ties directly into something that impacts every family that we care for, is health literacy. It's so important, but I don't think it's often talked about. It's often overlooked, especially in the hospital setting. How do you define health literacy, and why is it such a critical process or part of NICU discharge experience?
Yeah, great question. So health literacy is, and I love how you kind of worded that. I feel like it's kind of the little forgotten part about education and the healthcare process. It's very easy for us to get caught up in care plans and, direct patient care and all of that great stuff. But it's something that truly is in every single aspect of our healthcare system. So the previous definition of health literacy was essentially a person's ability to understand and interpret health information so they can make health-related decisions. But one of the really cool and pretty groundbreaking changes in health literacy was that with Healthy People 2030, they actually modified those definitions and they split them up. So now there are 2 definitions that embody health literacy. One is personal health literacy, so a person's ability to, seek out, understand, and interpret health information. And then the second definition is organizational health literacy. So this is incredibly groundbreaking because this takes the scope of health literacy from being incredibly patient-focused, where we were previously saying, hey, patient, this is on you. Your ability to figure out what this complicated medical document means. And now it's taking a step back and it's realizing that as organizations and hospitals, we also have a duty to provide education in a way that is understandable to these patients. So that organizational definition of an organization's ability to provide clear, consistent information to patients that is easily understandable is incredibly groundbreaking and has changed how we see health literacy today. So a really cool modification that I feel like has really tried to bring health literacy to the forefront of our minds.
Yeah, and that's a clear reminder that there is a difference between just receiving the information versus understanding the information. And that's where nurses make the difference, because we all have discharge checklists. And it's like, yes, I gave the parents the information on formula mixing, but Yeah, but do you know that they can understand how to do that formula mixing? So, we have to make sure that they might need, like you said earlier, handouts to understand. Maybe they need to watch videos. And, like you said, with the two different definitions of health literacy, that's putting it on the organization to make sure that they're providing the right information to the families. And it's no longer up to families. Is that what you're saying with the two different definitions?
Yes. Yeah. So I feel like it gives it a really well-rounded kind of scope now where just like how you kind of illustrated there's step 1 and then there's step 2. Because as an organization and as a hospital, if I hand you a piece of paper that just has gigantic paragraphs on it with a bunch of medical jargon, that's on me because I should have handed you something that is easy to understand. And I feel like a lot of the initiatives that we have had in health literacy really want to take a universal precautions approach. So, in my project, I utilized the health literate care model, which does just that. It takes a universal precautions approach. So, that's saying it doesn't matter essentially if you have low health literacy or high health literacy, all education should be provided essentially equally. So, we want to make sure that we are providing education that is easy to read, understandable in their language, which I feel like is a huge barrier that we experience a lot. So an example to kind of illustrate the marriage of these two definitions would be a really common neonatal diagnoses that we have, like a PDA. So, we are talking to this family about PDAs. We're typically giving them some sort of education about PDAs and initiating that education process. Now, personal health literacy, that family, they may not be able to understand or comprehend that handout that we've provided to them. But as an organization, we have a duty to provide them a piece of education that is understandable and easy to read. So, as an organization and organizational health literacy definition, I need to be handing this family a handout on PDA that is written at an appropriate reading level, has plenty of pictures to illustrate what that PDA looks like. It needs to be available for them in their native language. And then for personal health literacy, that family needs to be able to actively participate in that conversation. They need to read that handout. They need to ask the questions. They need to actively participate in that education process and, voice when they feel uncomfortable.
That's a great example. That makes so much sense now because it's more of like cyclic, right? So we as the organization provide the handout on PDAs with all of the illustrations, all of the information that they would need to know to understand it. And then it's now the parents or families' responsibility now to read that information and determine if they understand it to then ask more questions. So that's shows you again how I said earlier, the nurse is that bridge to make sure that the parents understand. So, how many times are we in the room with a family when the surgeon leaves to give an update about the surgery that just happened? And you just see the parents and they totally don't understand anything that they just said. And then you, the nurse, are left there to then make sense of the information that surgeon then just provided to the family.
Yes. And I love how you just worded that because I never thought of it in that way. And I love that you said that nurses are really a bridge between these two definitions, and they 100% are. So I absolutely love that.
And it really sets the stage for nursing to realize that we can improve these experiences for the families now that we have those two definitions and we understand it. And that's how important we are in making sure that parents have the literacy and, we are the advocates for those families during the time in the NICU and to set them up for the future.
Yeah, we really are. We really are. We are the person that can look at the personal health literacy and say, oh, this family, like you said, you're like, oh, this family is very overwhelmed. Maybe they're not, grasping all of this. And then looking at the organizational health literacy and saying, is this PDA handout actually doing the job that it needs to do? Do we need to look at this again? And it's kind of providing a marriage between those two definitions. And the nurses are right in the middle of that, facilitating both aspects.
So, looking where we are today with these two new definitions, what can hospitals and NICU teams do to strengthen and improve their discharge education process?
Yeah. So, hospitals, nurses, essentially any healthcare provider, I feel like just taking a look at it and saying, okay, is what we're doing working? Is this actually benefiting our families and our staff? Essentially, is this hitting the mark still? Because the medical community, healthcare in general, it changes overnight. What we are currently practicing today is not necessarily what we were practicing, years ago. And my brain always thinks about like NRP and when we would suction below the cords for mech deliveries and things like that, where I'm like, things have obviously changed a lot over the last few years. So I feel like just taking a look at that current discharge process, maybe forming a parent collaborative where those parents can come together and say, hey, what was your discharge process like? What was your experience on the NICU like? And just get feedback from them on how we can improve. And then we do have some national resources that people can leverage to, help them in terms of making these pieces of content. So you can look at the, CDC website. They have a huge section on health literacy where you can read more about the definitions, read more about the National Action Plan to improve health literacy and the health literate care model and all of those great things. But I feel like really where hospitals and us as healthcare providers need to look into more is technology. How can we leverage technology to help us hit the mark on educating our families? And I always think about how we are just increasingly more and more on our phones every single day. And, how we're very quick to use social media or, just a simple Google search to give us information about really important medical topics. And there's always that risk for misinformation when we utilize, unvalidated sources or a general Google search. So I feel like hospitals and organizations really have a duty to leverage technology to try to educate our families in a technologically savvy way, but also in a way that helps to streamline that education process for families and for staff as well.
I love the idea of having a parent collaborative because that's the great source. That's the source. Meet them where they are and say, what struggles did you have with the discharge educational materials that we gave you? You mentioned we send babies home on feeding tubes. So what did you find confusing in the discharge, and really streamline it to them? And maybe we need to start creating more digital educational materials for discharge. Meet them where they're at. Those are very quick, fast ways. Like, why not make it more of like a TikTok and say like, hey, this is what you do for insertion of an NG tube if it falls out at home. Meet the parents where their educational needs are instead of here's a handout, here's another handout, because we're kind of getting past that. We're more in the digital age and we do need to be more savvy with our education. And we need to really look at what our materials are, our discharge educational materials are, but what kind of questions should we be asking ourselves when we're looking at it, whether or not this is an effective tool for education?
Yeah. So, and I feel like first, I almost want to touch on a certain point about discharge, where discharging our NICU babies, it's something that, we kind of check it off the list. It's like, okay, they're off the unit. Bye, see you later. And we really never hear about them again. Sometimes you hear about them if they qualify for follow-up clinic visits, and you'll hear, someone say, oh, I saw them in follow-up clinic. They're doing so great. But we kind of lose track of these families after discharge. So I feel like discharge education and how well we do it is not a problem that is consistently in our face. When you're on the unit, it's very easy to see like, oh, a feeding error or a medication error, because that affects you that day, that moment, that patient. And discharge education, miseducation or undereducation you may not see that until that baby has been home for a few weeks. So it's not a problem that is directly staring us in the face every single day. And oftentimes, these families are trying to kind of check off that list as well so they can get home as fast as they can, but also still try to learn as much as they can. And the discharge process, kind of gets smushed into those last few days and it's very hectic. So, that discharge process is not necessarily a problem that we see every day, but it's something that is definitely a problem later on. And, that contributes to hospital readmissions for miseducation diagnoses. Maybe there was improper mixing of formula or something like that, and it wasn't caught until that baby saw the pediatrician 3 days later, a week later, something like that. So I feel like the fact that it's not something that's glaring to us every single day is even more reason why we need to pay attention to it and why we need to ask about, essentially see how we can improve it. And then when reviewing content and looking at pieces of content, like I said, we have a lot of resources that we can utilize to help us look at the health literacy of a piece of education. So, we can utilize the various tools that we have, such as the Fry tool, Flesh Kincaid, SAM tool, which is the tool that I utilized in my doctoral project. We can look at the rating level of that piece of education. You can utilize the SAM tool, which helps you really look at the piece as a whole. So do we have enough graphics in here to support these families who are more visual learners? Is this written in a very intuitive and interactive manner? So is this piece of education not necessarily just giving the parents information, but is it also asking them to simulate that learning, help them stimulate their learning centers, asking them questions, having them fill out a fill in the blank question or something like that? So there are various tools that we can utilize when reviewing content, but I love what you said earlier, Jill. A really, really great way for us to do that is that parent collaborative. It's something so simple and something that's really boots on the ground where, you can ask these parents, hey, did we do a good job? What were the areas that you thought we could improve on? And really getting an opinion from those families right away.
I love that the focus is on reflection and innovation. Like, we're looking at what we have and thinking, is this really helping our families? Is this really getting the job done? And I think that's a really forward-thinking approach. And the perspective that you put out there saying, we don't see how our discharge teaching works because they left. And, we can see those outcomes and results of all the other things that we do in the unit every day, but not with discharge. And that was a really good way of putting it because it really changes your perspective. Are we setting these parents up for success? Like, we may think we are because, like you said, they checked all those boxes in those last 3 days of the rush to get out, and the parents want to go home too. So, but, are we really doing the best for them? Are we really meeting their needs? So it does take a lot of reflection and innovation now, because I think a lot of our discharge materials probably are old and definitely need to be revamped. And like you said, those tools you mentioned that you can make sure, are you giving the parents the right opportunities to learn from the materials that we're giving?
Yeah. Definitely. And I feel like that's another great spot where nurse advocacy can come in as well, where as nurses, you are boots on the ground. You're at the bedside. You're the one that's giving this handout to this family, and you're the one that's answering the questions on it. Like I said, with my project, it was one small thing that I wanted to change that led me to this bigger purpose and this bigger passion. And it can be the same thing for that bedside nurse. Maybe you hand out that, education piece on PDA and you're like, we have one picture on here. And you're like, this is crazy. We need more pictures than this. We need to update this for sure. And it can take that one small change, that one nurse to make a change that has a butterfly effect and affects all those families that come after her, help them understand PDA and just overall improve that education process in general.
As we wrap up, what's your call to action for nurses listening, especially for those nurses who might be seeing a gap or a challenge in their unit like you saw when you started your work?
I think really the call to action for nurses is not only to be an advocate for your patients and for your families that you're talking to every day, but is to also be an advocate for nursing as a profession. I know that, the medical community and healthcare changes lightning fast. So, changes happen. And I feel like every single day, we need to make sure that we're doing the best that we can for our patients. And I feel like one of the really large takeaways from my DNP project was that we have a duty as hospitals and as organizations to provide education in a way that is understandable and truly meets our families and patients where they are. And as nurses, we have a huge call to action to advocate for our profession as well. We know how unique and how special the bond is that we have with our families. And we need to make sure that we're speaking up for them and for ourselves as well.
That's such an inspiring message because all it takes is just one nurse, one idea that can just make everlasting change. So, Samantha, thank you so much for joining us and sharing your insight and passion for improving discharge experiences and also empowering nurses to drive change. So thank you. Make sure you never miss an episode of NANcast by subscribing now. This podcast is made possible by listeners like you. Thanks for your support and letting us into your ears. Have a great day.